Crying is the shedding of tears in response to an emotional state, pain, or a physical irritation of the eye. Infant crying is a sign of pain, distress, hunger, or fatigue. The cry just after birth heralds the infant's health. The screams of the same infant 6 weeks later may be interpreted as a sign of illness, difficult temperament, or poor patterning. There are 3 different types of cries apparent in infants. The first of these 3 is basic cry, which is a systematic cry with a pattern of crying and silence. The basic cry starts with a cry coupled with a brief silence, which is followed by a short high-pitched inspiratory whistle. Then there is a brief silence followed by another cry. Hunger is the main stimulant of the basic cry. Second is an anger cry. Much like the basic cry, however, in this cry more excess air is forced through the vocal cords, making it louder, more abrupt cry. The third cry is the pain cry, which unlike the other 2 has no preliminary moaning. The pain cry is one loud cry, followed by a period of breath holding. Cry is best understood by the characteristic of timing, duration, frequency, intensity, and modifiability of the cry. Most infants cry little during the first 2 weeks of life, gradually increasing to 3 hours per day by 6 weeks and decreasing 1 hour per day by 12 weeks. Premature infants cry little before 40 weeks gestational age, but tend to cry more than term infants at 6 weeks corrected age. Frequency of crying is less variable than duration of cry. At 6 weeks of age, the mean frequency of combined crying and fussing is 10 episodes in 24 hours. Crying concentrated in the late afternoon and evening. The intensity of infant crying varies, with descriptions ranging from fussing to screaming. Pain cries of newborns are remarkably loud, although pain cries have a higher frequency than hunger cries when not attended for a protracted period. Hunger cries becomes acoustically similar to pain cries.